Well, as you have just heard in the segment that you just aired, it has been of shock. This is a terrible moment for the world to be hearing those type of statements from the biggest donor of WHO. I have to say, however, that in reality, even though the U.S. is the biggest donor and contributes 15% of the $2.5 billion annual budget of WHO, at the end of the day, less than 2% of that support goes to humanitarian emergencies or pandemics, such as COVID-19. So it is in many ways political posturing at the moment.
Well, thank you for clarifying that in terms of sort of how much this is actually going to impact the WHO. But explain for us the WHO's financial structure. Where does the organization, the majority of its funds, come from and go?
Yes. So the WHO has at least 3 levels of financial contributions. The first one is related to the mandatory fees that each of the 192 member states has to pay. The second one is related to voluntary contributions from the member states, and that's where the U.S. by far is the one that provides the most. And thirdly, there is now a very big role for philanthropic organizations such as the Bill and Melinda Gates Foundation, which now contributes with about 10% of the annual budget of WHO.
So then with so many health causes to choose from, how are the funds distributed and how is that decided?
So that is where a lot of the issues have happened historically and continue to play at WHO. Obviously, the big donors, such as the U.S., want to have a very strong say on which the priority should be and how the funds should be used. Oftentimes, that is not fully aligned with what the poorest countries need or have in mind. So there is a tension at WHO between what we refer to as the vertical or top-down management of the organization versus a more horizontal, democratic, and a consultative type of system where actually the countries and the regions play a much bigger role in deciding how the funds should be used according to their needs.
So then as we look at where the WHO was when it was first established versus the role that it's taking on now, how much has that changed?
So it has changed quite a bit because we know now that the WHO has 6 regional offices all over the world, including the Americas, Southeast Asia, Eastern Asia, Western Pacific, Europe, and so on. And the countries through those regions are playing a stronger role in terms of influencing what the priorities of the organization are. However, when there are disputes between the big powers in the world, for example, right now, the back and forth happening between the U.S. And China, it starts really putting behind the scenes what actually the debate should be about, which is what are the different countries in the world needing now. For example, yesterday an article was published indicating that there are a very large number of countries in sub-Saharan Africa where they don't have a single ventilator. If the COVID-19 pandemic ends up affecting sub-Saharan Africa in a strong way, they are fully underprepared right now, and the world is not paying attention to their pleas for needs and for a way to manage this pandemic.
So then, given some of the louder political voices we're seeing as this is becoming more politicized, and as we look at perhaps what could be ahead for the WHO in a post-COVID-19 world, what's your outlook for perhaps how it will look in the future for the WHO?
Yeah, I think WHO, as well as many other international organizations, NGOs, and philanthropic organizations are realizing that they better all get their act together, because this is the 5th or 6th pandemic of this nature that has happened over a period of 10 years, H1N1, SARS, MERS, Ebola, now we have COVID-19, and it is very clear that global pandemics don't care about human-made borders or boundaries or fences. Essentially, all the world needs to be prepared to monitor, to have better surveillance, and to have a much greater speed of reaction when these type of problems are detected. And this will call for a massive redistribution of the way we use global health funds from curative investments towards much more preventing public health promotion types of investments. That's what I think the world should be learning. And if we don't now, I don't know when we will ever will.
Certainly